Dr. Paul here. How you guys doing? We're gonna go in and see a 9-month-old who's had a recent new problem of not wanting to sleep. Let's go take a look. Hello. So tell me what brings you in today.
Well, the last 3 weeks or so, he has just not been sleeping good at all.
Okay.
During his nap times, he wakes up every 20 to 30 minutes.
All right.
And then
Before 3 weeks ago, what was his pattern?
He was taking 2 hour-and-a-half approximately naps.
Okay.
And then
now he's just waking up every 20 minutes?
and I have to re-put him back to sleep. And
Okay.
he usually goes to sleep very quickly within
Did nighttime change at all?
Yes. So at nighttime now, he used to wake up, he goes to sleep at like 8:30, and then now would wake up between anywhere from 4 to 6 a.m. And now he wakes up almost every hour.
Wow. So when he does wake up, what's going on? What do you do?
When he wakes up, I usually just nurse him or either hold him and just comfort him back to sleep.
He goes back pretty quickly?
Usually, more towards the morning, it gets a little bit harder for him to go, but I mean, it takes him a little bit longer, but he always does usually go back.
That one's perfect. That one's perfect too. New bottom, 4 top. They look fine though. I don't see any new ones coming. Kids will be fussy when they're teething, of course.
He's making me laugh because he usually smiles so much. And he's just looking at you.
It's just these masks. It's really a handicap for a pediatrician. This is a handicap.
That's right.
Hi. All right, so I'm gonna try looking at his spine as well.
Okay.
I've learned we have a bodywork specialist, I think you know, Dee Dee.
Yes.
From one of your prior kids. Sometimes she'll find tightness in the spinal musculature or up here in the occipital area that will just be keeping kids sort of awake. Is he pulling to stand at this point?
Yes.
Okay. Crawling along furniture?
Yes.
So if you have a hip problem, when you rotate the hip, you'll see kids just wince in pain. And yeah, you're fine. The first theory is, you're gonna think this one's silly.
Okay.
But you are such a nice mom, like such a wonderful mom. I'm gonna put myself in his shoes.
Okay.
Okay. Now when I'm a baby and I'm hungry and you feed me, it's like, that's cool.
Yeah.
But when I get a little older, like right around 7, 8, 9 months, right around this time, my mind is starting to figure out cause and effect.
Okay.
To like almost consciously going, when I cry, mommy feeds me and she holds me and she cuddles me, and I like that. Right? So if I figure that out, and since you're so amazing, I'm waking up.
Yeah.
Because you're gonna put me on the breast, you're gonna cuddle me, and I just feel like, oh, that's like the best thing in the world, right? It's like candy. It's like so good, all right? And so you give me the love I want, and I feel like everything in the world is okay, right? So I fall asleep. But then I just startle, whether it's because I've got a little gas pain or a tooth coming in, which I didn't see any of that, or who knows, I just start to kind of pay attention to, oh, I'm awake again.
Right.
Now, if I'm just totally quiet, you don't come feed me. But if I cry, you come, oh, and I get fed and I get cuddled and I like it. So there's a pattern that can develop where kids are just figuring out and they like it.
Okay.
So that's one possibility.
Okay.
The other possibility, plan B, would be maybe there is some tension along the spine for whatever reason. He slept wrong. I mean, we have kids who they sleep kind of cockeyed and they get what we call torticollis.
Okay.
Where one of these muscles is too tight or they tweak their back and they're just waking up a lot because they're tense.
Yeah.
And a visit or two with a baby massage person and it's over, right? So that would be nice if that's all it was. If it was the first thing where he just loves the attention.
Yeah.
That's a brings up a really tricky sort of parenting style decision that you've got to make.
Okay.
I personally think this poor guy behind the camera, okay, that's my son, and yeah, that guy, and when he was this age, he would do this, like want more attention, and I was raised and I was taught in school that you sleep train kids this age, otherwise they become, quote, spoiled.
Okay.
Or they just won't learn to self-console.
Sure.
So to some extent you ignore them. I mean, you'll check on them, make sure they're okay, but you let them learn to self-soothe.
Okay.
That's one style of parenting, which I did with my poor kids.
Okay.
And I wonder, sorry son, apologies.
Oh, you were just doing the best you could.
Thank you, son. You know, I just wonder if maybe some ongoing anxiety from not having all your needs met as a little kid could result from that style of parenting.
Right.
So I'm not an advocate of sleep training as such, although I know it works.
Okay.
It absolutely works. I can totally teach you how to do it.
Okay.
But I see other moms who are probably more like you, who just are so loving, and I'm thinking, oh my, that would be so cool, right? If you're a kid and you're feeling a little anxiety and you just have your needs met.
Right.
He'll outgrow it. You know, this will pass. This phase will pass. Now, whether it passes in a few weeks, a few months, or a few years,
Okay.
that part I don't know.
Okay.
So let me go grab Dee Dee, and she can do a little spinal assessment.
Okay, super. Thank you so
Yeah,
much.
and I'll be right back.
Thank you.
Okay. Oh, Dee Dee. This is the massage world. It's amazing. So I do have a baby that would love to see you.
I would love to see the baby.
Okay.
I'm not
Hi, Dee Dee.
Hi.
Hey, I think you guys have met before, actually.
Oh my gosh.
So that's pretty
Hi.
cool.
Can I feel? Hi. Look at you. It's more comfortable for them to sleep on their stomachs when their backs are that tight.
Okay.
And that's a pretty common thing. When that happens though, when they grow, it grows a little bit like that. So the tension along the spinals and the paraspinal muscles gets tight, it pulls, and then in the night they get uncomfortable and they try and move, and so they'll tend to wake up more. Sometimes that can be part of it. So with that amount of tension, what I would do, and with babies, a lot of times is we do decompression.
Okay.
We put little cups on there and I move them around. Do you want to do that real quick? Do you want Noah to come with us?
You were
You're actually
happy
gonna
about
get your
that.
first little treatment.
You just don't know me. We were thrown together so suddenly. We don't have snacks. With the session, we bring snacks and things.
Okay.
Yeah, that should feel good, sweetie. Yeah, that should feel good. Do you see you? What's really good about this is that it feels good generally to them.
Right.
And so I'm just sliding up and down. So again, we'll do a session together and I'll kind of explain more in depth when you do it, how you do it, directions with lymphatics.
Okay.
But it really can really make a difference. And a lot of it is that positional thing, using things like side sleepers to get him to kind of get onto his side and off his stomach.
Okay.
Because once we loosen that up, then it's easier.
Okay.
But keeping him on his stomach is then what sort of reinforces that curvature.
Okay.
What do you think? Yeah? You want to come back and get a massage? See, as long as he's into himself, I can just keep on cupping.
And so this sort of thing just relaxes him and ideally keeps him more calm at night.
But yeah, so what this is doing is by lifting up and increasing the lymphatics, it decreases the amount of tension.
Okay.
When babies are tight and uncomfortable, and especially stomach sleepers, that tension builds up. He moves a little bit, and it will wake him up.
Okay.
So in general, as in adults, as we get tight, we're uncomfortable when we go to sleep at night, we have to lay on our side or turn sideways, or we'll put a heating pack on. We'll do things for ourselves that relax our muscles and allow us to sleep. If we're really tight, we have a harder time sleeping.
Right.
Stress in general keeps us from sleeping. But with babies, same thing. It's hard for us to think, well, why would a baby have any stress and tension? Though they generally are grown with it. Birth trauma, all kinds of stuff.
Right.
So that physical tension in there, and he's a big kid, so when he's growing, it's just kind of getting tight in there.
Okay.
So the biggest trick would be getting him off his stomach.
Okay.
Watching spinal positions in general when he's sitting or doing anything. We want to always think about our noses lining up with our sternums.
Okay.
So if you're carrying him around a lot and he's only on one side, he's going to favor that side. He's going to
I
turn
see.
that way. And it's
Okay.
going to cause the one side to grow differently than the other side.
Okay.
Does that make sense?
Yeah.
Okay.
This is the side I usually put him on, so does that make sense, actually?
Yeah.
Yeah.
So it's really changing. And it's hard. We don't think about
Yeah.
that. We don't think that we're going to grow any differently.
Sure.
And a lot of times it doesn't necessarily bother people until they get a little older. And so
Right.
that's the idea now of preventing that so it's not something down the road.
Right. Okay.
See?
Can you give us a smile? Can you give us a smile? There we go.
Serious. All right, you guys.
All right.
Bye-bye.
Bye, thank you. There are worse gigs than having the chance to film adorable families and beautiful little babies.
Well, folks, there you have it. Sometimes it's a journey to figure out what's going on for a patient, and that's the fun part of my job. I mean, it's like being a detective, and hopefully we figured it out. I'm pretty sure we did. Thanks for watching. I'm Dr. Paul.